The monocomponent insulin preparations differ from the conventional preparations in the following respect, except they cause less hypoglycemic reactions. Insulin resistance can be minimized by the use of monocomponent or human insulin. Human insulins are obtained by the following methods, except cadaver pancreas. Compared to pork or beef insulins, the human insulins have faster kinetic of absorption and elimination. Which of the following is not a specific indication for the more expensive monocomponent or human insulins? Type 1 diabetes mellitus. The second generation sulfonylurea hypoglycemics differ from the first generation ones in that they are more potent. Metformin is preferred over fenformin because it is less liable to cause lactic acidosis. Sulfonylureas do not lower blood sugar level in type 1 diabetes. Sulfonylurea hypoglycemics act by increasing insulin secretion from pancreas, reversing down regulation of insulin receptors. Which of the following drugs can precipitate hypoglycemia if given to a diabetic controlled with sulfonylurea drug? Chloramphenicol. The hypoglycemic action of sulfonylurea is likely to be attenuated by the concurrent use of hydrochlorothiazide. Chlorpropamide is not a preferred sulfonylurea because hypoglycemic reaction is more common with it. Incidence of alcohol intolerance reaction is higher with it, and it can produce cholestatic jaundice. Metformin causes little lowering of blood sugar level in non-diabetics. The first phase of insulin release from pancreatic beta cells is augmented by nateglinide. Choose the correct statement about nateglinide. Taken just before a meal, it limits postprandial hyperglycemia in type 2 diabetes mellitus. Which of the following is not a sulfonylurea but acts by analogous mechanism to bring about quick and brief insulin release that is useful for normalizing mealtime glycemic exertions in type 2 diabetes mellitus? Repaglinide. Metformin acts by suppressing gluconeogenesis and glucose output from the liver. Choose the correct statement about pioglitazone. It acts as an agonist on nuclear peroxisome proliferator receptor gamma. It enhances transcription of insulin responsive genes and it lowers blood sugar in type 2 diabetes mellitus without causing hyperinsulinemia. The thiazolidinediones are mainly used as add-on drug to the sulfonylurea and or a biconide in type 2 diabetes mellitus. The present status of oral hypoglycemics in diabetes mellitus is they are used first in most uncomplicated mild to moderate type 2 diabetes. The following feature disfavors use of oral hypoglycemics in diabetes mellitus. Insulin requirement more than 40 units per day. Which of the following is true of acarbose? It limits postprandial hyperglycemia in diabetics. The following anti-diabetic drug inhibits intestinal brush border alpha glucosidase enzymes. Acarbose. Gargum limits postprandial glycemia by slowing carbohydrate absorption from intestine. Select the drug which tends to reverse insulin resistance by increasing cellular glucose transporters. Rosiglitazone. Glucagon release from pancreas is stimulated by adrenaline. The sodium retaining action of aldosterone is exerted on the distal convoluted tubule. Aldosterone enhances sodium reabsorption in renal tubules by inducing the synthesis of sodium potassium ATPase. Hydrocortisone exerts the following actions: increases both potassium and calcium excretion, Adverse consequences of excess mineralocorticoid action include the following except acidosis. Glucocorticoids impair carbohydrate tolerance by promoting gluconeogenesis in liver and depressing glucose uptake into skeletal muscles. Corticosteroids exert anti-inflammatory action by inhibiting the following enzyme phospholipase A. Hydrocortisone induces the synthesis of the following protein, which in turn inhibits the enzyme phospholipase A2, lipocortin. The glucocorticoid receptor is located in the cytoplasm.